Our family is a little unusual in the OCD spectrum in that Katie kept her OCD from all of us until she basically decompensated. She took herself to a local mental health facility and asked for help, and I got a phone call. This is our town's youth service. There's an issue here. We'd like you to come over. Now, I'm a pediatrician, so to walk into this health center and have them say, your daughter has severe OCD, and for me to have no idea, just was, it's like before and after. There's the before the call and after the call in our life. Over a very short time from finding out about the diagnosis, it was to total decompensation for us was 6 months. And that included a partial hospitalization for a month and 2 inpatient hospitalizations for 2 weeks each. And it was very difficult at first. I didn't feel like I could tell anyone. The only one in my family that knew was my sister, and the only friend was my best friend. And I just felt like I couldn't be myself. And then, I don't know when the turning point was for me. At some point, I just decided, I can't do this anymore. I was trying to respect what Katie wanted, but at the same time, I felt like I couldn't do it anymore. And I also decided as a medical professional that I could not continue the stigma of mental health. I knew that if Katie had been in a car accident and broken her back, if she had diabetes, if she'd had any other medical issue, people would know about it. And I also knew that what happened to Katie and was happening to us didn't have to do with poor parenting or poor or bad peer choices. This was an organic problem going on in her brain, and I had a duty to myself and to her and to the world to let them know that this is happening and this is what we're doing about it. I think in terms of the hardest things I've had to do as a mother was admit her to inpatient twice and to leave her in Wisconsin, not knowing how it was going to go. We were fortunate. We had the resources. I was able to visit her almost every other week, either myself or my husband. 2 of her brothers were able to go out. We took her dog out one weekend. But it was clear to me within the first week to 10 days and talking to her on the phone that she was in a place that was going to help her. Every time I saw her, everything I heard from the staff, I just, I was amazed. And I'd been saying to her all along, she's a very shy, conservative, doesn't like spontaneity. Life is supposed to be fun. Let's have some fun. And she could never believe that. And one time when I was visiting, she said, you know, life can be fun. And Rogers helped her become it brought her out of a shell that she couldn't have gotten out of by herself. And it gave our family back our daughter and my boy's sister, and has given us an incredible amount of strength as a unit and just pride and gratitude.